Hi everyone, I'm Dale Smith, aka Journo Dale, and we're here to talk about Canadian politics.
All right, we are back with Dr. Jennifer Robson from Carleton University, and I figured we would talk about dental care because this is the one thing out of the budget that everybody keeps talking about. The big thing is, how is this going to be implemented? Because they haven't given us any details. Jennifer has given a couple of Twitter threads of possibilities, so I figured we'd get her to lay what some of them might be. Jennifer.
Hi, thanks for having me back. I feel like I'm continuing on in my role of Debbie Downer of Canadian social policy. So I just want to preface this by saying I am not anti-teeth. I am very keen on making sure that Canadians have access to good dental care, especially kids and families that can't afford to pay for this out of pocket and who don't have access to private insurance. But how to go about this is not straightforward, right?
It's a big question with jurisdictional hurdles.
There's jurisdictional hurdles for sure. So right now, basically, all provinces have some form, like in varying degrees, of publicly insured dental services for some populations and or some procedures, right? So there'd be some dental care that is deemed to be medically necessary that if you have no private coverage, you can probably access through the hospital. In other cases, if you are very low income and are willing to jump through the often demeaning process of applying for government income tested benefits like social assistance, for example, then you can get access to the publicly insured forms of dental care. Of course, depending on the jurisdiction, different forms of services are provided, and not all dentists are willing to participate in those programs. The fee schedule is certainly less than what they make through their independent private practice. So that's kind of the current lay of the land. So, genuine challenges to be dealt with. And you have this issue of you've got a federal government coming in, and what are they going to do? Are they going to develop a program that would essentially layer on top of those pre-existing provincial programs, in which case there's the real possibility of some problematic interactions. So it would be kind of fiscally not surprising to see a province say, that's great, federal government, that you're willing to pay for example, they're going to start with kids in low-income families, right? It's great that you're willing to pay for kids, so we're going to stop paying for that, right? So we're going to withdraw services. And in many cases, what ends up happening is that actually the new program does not keep pace with the withdrawal of provincial services. So some people actually end up materially worse off. Another issue, of course, to deal with is that the federal proposal is going to be uncontested, right? So they're saying we're going to start with kids, and it's only ever going to be for Canadians who are in households making $90,000 a year or less. There will be some number within that income group who do actually have access to private dental insurance through their employer, for example. So, of course, private employers are always keen to not be the first payer, right? So you could also end up in a situation where not only are you facing coordination issues with provinces who, again, have that like real patchwork of different systems of what's covered, what's not, who's covered, who's not, what's the billing rate, all that sort of stuff. But now we've also got this coordination issue with the private insurers. So that's one way of going about it, is basically the federal government sort of sets up its own insurance plan that only some people are eligible for and tries to administer benefits, and then runs into all of those coordination issues. That's one plan. I have real worries. And I think we already saw, I think you had tweeted this as well, we already saw at least one premier come out and say, not only is this a coordination issue, but if you're defining dental care as essential medical care, then that's very clearly our jurisdiction. Thanks. We'll just take the money and we'll manage from here.
Yeah. Yeah, premiers are keen to do that.
They are, and why wouldn't they be, right? It's,
Yeah.
in many ways, it's more straightforward to just get the cash transfer from Ottawa and use it to to distribute within the programs that you already run. Maybe you enrich them, maybe you don't. Um, that would be another avenue to be able to do this,
Hmm.
right? They could
And
just do
my
transfer.
concern with that, though, is how do you design a cash transfer that you can attach enough accountability measures to or conditions to ensure that they actually do get the coverage, as opposed to
Yeah.
that money winding up in another pot.
Money's always fungible, right? And so there is no special tracking device that you can put on federal transfer dollars to provinces that sort of set off little, mini fiscal alarms if they are used to pave roads or cut taxes instead of the thing that they were supposed to be used for, right? It just doesn't work that way. What you can do is essentially the model that we've seen with the early childcare agreements, right? Which is the federal government says, we're willing to come to the table. We have certain policy objectives. If you as provinces are interested in these policy objectives, let's talk. We'll come up with agreement on, some outcomes that we both like,
Mhm.
and, a plan for reporting and that kind of thing. I realize for people who are keen to think about using the federal spending power as like some kind of like lasso of truth, right? Like I'm just, I'm going to put this around a provincial premier and make them do what I want them to do. Sometimes those agreements end up feeling less than satisfactory because the federal spending power is successful in buying the policy change that provinces are willing to engage in. But it's still something, right? Like
Yeah.
progress is still possible through those routes.
So one of the other things that was kind of discussed was this notion about extending the existing non-insured benefits program, which I think is for First Nations people, and using that as the mechanism. And I think that's what the NDP had proposed in the report that they got the PBO to commission for them. You had some concerns about some of what's in there, and I wonder if you can just kind of lay out what those were as well.
Sure. So this is a program that exists through Indigenous Services Canada, obviously targeted only to those Indigenous persons in Canada with status under the Indian Act, but it's not income tested, right? And it's a suite of health and dental benefits that are packaged into one plan. So what happened was that the NDP had asked the PBO to cost a program using that as the baseline model, like sort of if we did something but expanded the target population to be non-status Canadians below this income level, what would it look like? And so that's the model that the PBO used. And of course, this was again repeated when the NDP ran on this in the most recent federal election. So a couple of concerns about that program when you start to sort of scratch below the surface. First of all, it basically has a gatekeeping function of determining eligibility on the basis of status, which we already know, like that's fraught and all the rest of it. But when you layer on this issue of income testing, this is going to mean relying on people filing tax returns. So if you don't file a tax return, no dental benefit for you, even if you are in fact living in poverty, right?
Yeah.
So that's one concern. The other concern is that if you actually look at how the program itself is running over at ISK, I don't know that this is something that people would sort of say, oh yeah, please give me more of that. So it costs about $2 billion a year.
Okay.
But there are pretty clear concerns that have been voiced by the AFN, as well as other Indigenous communities, and recognized, I will say, like, ISK seems to know they have a problem on their hands with the coverage and quality of dental benefits. In other words, like, yeah, it covers some stuff, but not necessarily everything that you want. And the quality of the service that dental providers are willing to provide at that billing rate may not be kind of up to what we think of as being acceptable standards of community practice, right? That we might be used to in terms of thinking about dental care. And there's this huge problem of eligible non-participation, especially for dental benefits. So I came across one report from the AFN that was saying, like basically take up of the dental part of this plan is somewhere in the neighborhood of like 30 to 40%. And it's not totally surprising. Like if you think it's hard to find a dentist who will work under this plan, you hear bad things about the quality of the care that you get. And then administratively, this is no more simple than any government program we are all used to sort of looking at, right? A lot of forms, a lot of rules, all that sort of stuff. And ISC doesn't run the forms and the adjudication of benefits, by the way, they outsource it. So it's actually more appropriate to think about that program as being a federally funded and the federal government is responsible for setting the rules and the terms, although they recognize that they have issues there and are engaged in a process with the Indigenous community to review those. But it's actually private sector run, right? So, yeah.
Okay. All right. So with all of these considerations in mind, my first question is, do we think we can actually get to the timetable laid out in the budget / the agreement that the federal government signed with the NDP?
Oh boy. Yeah. And look, there's a lot riding on this, right? There's very clear language in the budget, but also in that confidence and supply motion that by the end of this calendar year, there will be something that exists for low-income kids, right? Or sorry, kids in low and modest income families. So do we think we can get there? I noticed that the language of the budget said that this is money being allocated to Health Canada that has, by the way, no experience in setting up programs that have transfers to individual Canadians. But they do have experience in working with provinces and setting up, contribution agreements with both, subnational governments as well as other organizations. So, look, I would say they don't have a lot of time to get this right. There's a real risk here of essentially something being pulled together, with duct tape and hopes and prayers. Which not awesome, like it'll exist on paper, but will it actually work? Will people actually be able to access benefits? Will anybody actually have measurably better dental care than they are getting now? I don't know, but I feel a little bit optimistic that at least they gave themselves the flexibility to say, we're giving this money to Health Canada. Maybe Health Canada can find a way to work with provinces and territories, building out and building up and improving the systems that are there. So maybe that's a path forward, but tough timeline to get there by December 31st of this current year.
Yeah. Especially, considering how long it took negotiations with some of the provinces around childcare as well. That agreement took, especially in Ontario, took a very long time.
Well, and look, there's a good debate, I think, and maybe eventually in the fullness of time, some of the backroom stuff will come out as to, did it really need to take that long in Ontario? That's not entirely clear. But it, particularly because we're talking about starting with kids, my hope would be, right, that when you already have some premiers coming out and saying like, no, we very keen to partner with you on this, but we'll run the programs, thanks, that maybe there's actually a path forward there. There were some childhood deals that actually got off the ground pretty fast.
Yeah.
So yeah, you can have some early adopters for sure.
Okay. All right. Well, that's a lot of really interesting stuff for us to think about. Because this, I think this debate is going to be continuing for the next few months. So thanks so much for taking the time to do this.
Hey, thanks for having me back.
All right. Do this again. Thanks.
All right. Take care.
That's everything for this week. Join us again next week for some more Canadian politics. I'm Dale Smith. That's at journo_Dale on Twitter. And don't forget to like the video, share, subscribe, and support us on Patreon. Thanks, everyone.